Okay, so today I'm just going to be performing a postpartum assessment on our lovely patient Regina. I've already cleaned my stethoscope and washed my hands and have identified her with 2 patient identifiers. So how are you feeling today?
Feeling good.
Feeling good? And how's baby?
She's doing good.
Okay, do you have a name picked out for her yet?
Brittany?
Brittany? Awesome. And you said that you're like feeling good. Do you feel happy? Do you feel any sadness? What are your feelings?
I feel happy.
Happy, okay. And how's the baby feeding?
She's feeding good.
Awesome, sounds good. And so you're not worried about baby latching on to your breast or anything? Okay. And I just wanted to let you know, a lot of mothers do tend to have emotions that are super high strung, so it is okay to be crying a lot and be crying a lot for no reason, okay?
Okay.
And I'm just gonna be taking your vitals now. I'm gonna be taking your blood pressure, the blood pressure cuff. And I can see that blood pressure is in normal parameters. There's no evidence of preeclampsia. Put this down. I'm just gonna be checking your pulse as well for 60 seconds. I'm gonna pretend that 60 seconds has gone by and it's within normal limits as well. And I'm gonna take an oral temp. There you go. And I can see that it's also 98.6. Mom should have no fever. And I'm just gonna be listening to her respirations as well. And just take a deep breath in and out. Good, and if you could just sit up for me just a tad and do the same. All right, great, and you can lay back, and I can tell that your respirations are normal as well. Do you have any pain at all?
No pain.
No pain? Not even in your incision site?
Yes.
Just a little bit?
Just a little bit.
On a scale of 0 to 10.
5.
All right, sounds good. And I'm just gonna use my stethoscope to listen a little more. I'm gonna just listen to your bowels and make sure that they're becoming active. Because it does take a little while for your bowels to start up again once you've given birth, okay? And that's completely normal. And just breathe normally for me, okay? And I'm also going to be listening to lung and heart sounds while I'm here also. And the 5 cardinal spots. And for the mitral, I just have to go under your shirt. Just gonna, right here. Awesome. And if you could sit up for me just a little bit and just breathe normal. Sit back for me, and I don't hear any abnormal breath sounds. There's no presence of stridor or any wetness that's or anything that sounds wet. And bowel sounds were active, which is good. And I'm just going to be performing CVA tenderness now. If you could sit up a little bit, and you're just going to tell me if this hurts, okay?
No.
No. And tell me if this hurts.
No.
No. Awesome. And that's good. And since you are having a little pain, I won't look at your breasts, but do you have any cracked nipples at all or red spots?
No.
No? Awesome. And they should be soft and not so firm. Once they're firm is indicative of when you need to breastfeed, and it would be full of milk. So do you have soft or firm breasts?
Soft.
Soft, awesome. And any pain in your breast area?
No.
Awesome, sounds good. And that's awesome. And you did say that the baby was nursing okay and latching on all right?
Mm-hmm. Brittany's doing good.
Awesome, sounds good. And I'm just gonna put on some gloves now, and I'm gonna be palpating your uterus. So just, yeah. I'm gonna go right below the umbilicus and push my fingers in, and it should be firm to the touch, which it is. It'll become softer within the following days, and it is at the level of the umbilicus and not below or above, which is a normal finding. And if you you could just spread your legs a little bit. I'm just gonna see if there's any blood clots coming out or anything, which there isn't, which is a great sign that all the placenta has been out. So there's no lochia at all. I'll just cover you. And I can tell looking at your bladder that it's not deviated and it's pretty symmetrical, which is indicative of good bladder function, and your bladder is empty. And next time that you do use the restroom, just make sure that you void in the pan, and that you just call me whenever you've voided, so that I can measure your urine at least 3 times before you leave, okay?
Yes, ma'am.
And I'm just gonna be looking at, looking for lochia, which there wasn't any, but if there was some, I would be looking at the color, the amount, consistency, any odor, and the odor should just be an earthy smell. It shouldn't have a foul smell at all, and if there was, then we would be concerned for infection. So there was no clots, which means the uterus isn't boggy at all, which is what we want. We definitely do not want a soft, boggy uterus right now. And I'm just gonna turn you a little bit to the side and look at your episiotomy. You can come back, and I don't see any hemorrhoids, any presence of hemorrhoids, and your incision looks good. I don't see, you turn back, I'm so sorry. And I don't see any redness, ecchymosis, edema, discharge, approximation. There's no sign of infection or anything like that, which is great. And now I'm just gonna be looking at your Homan sign. Just gonna be feeling your calves. And you just let me know if anything hurts, okay? And I'm also checking for edema here, which she does. She has slight edema, but it's just +1, which isn't too bad. No sign of DVT, there's no redness. Do you feel any warmth in your legs at all? No? Awesome. So there is no sign of DVT. Did it feel tender at all?
No.
No? Awesome. And now I'm just going to be assessing your reflexes. If you can push this up. All right. And your other one. And then if you could dorsiflex your foot, so you're just going to push up that way. Okay. And then same here. And you have normal reflexes. There's no clonus at all, which is good. You have the +2 reflexes, which is within normal parameters, okay? And if you do have any discomfort feelings or uncomfortable feelings towards your baby, like you don't feel the need to hold baby, you don't want to bathe yourself, and you just don't feel normal, just make sure that you call the clinic and let us know, because that could be indicative of postpartum depression, which we of course want to know.
I will.
Okay, and now I'm just going to be looking at your stomach. For chlasma, your linea nigra looks very prominent, which is okay. And of course you still have stretch marks, but those marks will also go away within time, okay? They'll all fade. And are you sweating at all?
No, yes, a little bit.
Yeah? All right, sounds good. Well, that's actually normal.
Okay.
I just want to encourage you to eat 300 to 500 calories more than you normally do, because that's good for your milk supply to keep it coming, and of course you're breastfeeding, so you want to make sure that you have those extra calories and drink extra liquids, water, Gatorade, to keep your milk supply up as well. And again, that sweating is normal, and I would just advise you to not lift anything heavy. So don't even be bending over to do laundry or anything for a little bit, okay? And that concludes our postpartum assessment.